Hi everybody, it's Emily here at Thrive Wellness Center in Saline, and I just wanted to come talk to you guys today a little bit about menstrual cycles, what they entail, and all the different amazing things that our body is doing during the whole month of our cycle. So first I wanted to start off, I have lots of notes because there's a lot of great facts that I wanted to make sure I included. So I wanted to start off by making it known that our periods, when we are actually menstruating, that should not be a painful time, a time where we're feeling all these shifts and changes, which we are basically have normalized at this point. So, like cramps, headaches, migraines, moodiness, back pain, breast pain, all of those things. Our body is going through these bigger shifts, of course, but all of those things have been quite normalized when painful periods shouldn't be a thing. You shouldn't have issues with your period like super heavy bleeding or periods that last longer than 5 to 7 days, that sort of thing. So I want to first start off by saying that. And also a lot of modern medicine, their solution for those types of issues are things like birth control. And I also want to start off by letting you know that birth control, all that does is that actually covers up your symptom and can cause worse side effects than what you were going through in the first place. So birth control is synthetic hormones that help, basically they, subdue your body's capability to produce actual hormones that it needs to function and later in life also get pregnant, that sort of thing. Some side effects of birth control actually I want to talk about are high blood pressure, blood clots, strokes, headaches, weight gain, nausea, acne, spotting, a decrease in sex drive, and brain fog is a huge one. A lot of patients, when they get off of birth control, they're like, my brain fog is gone, I feel great. It's like the cloud has lifted. So those are some of the side effects we see from birth control. If you actually look at the insert for birth control, it's pages long, and it's just not great stuff. So it's kind of my little pre speech before I get into how awesome our body is. All right. So first we have the different 4 stages of the menstrual cycle. So we have when you're menstruating, so the menstrual phase, we have the follicular phase, the ovulation phase, and then the luteal phase. So our body is doing a bunch of different things during these phases. First, we'll start off with your menstrual phase. So this is when you're actually bleeding. So your body is, what it's doing is it's shedding the lining of the uterus along with mucus, blood, all of that stuff is what our body is doing. It's a detox. So again, in a way, if we are on some sort of birth control that's stopping your period from happening, you also are eliminating that detoxification process that our body really needs to go through to eliminate anything that is unwanted in that vicinity. So this will start when an egg from the previous phase is not fertilized. So you're not pregnant if you are starting your period. The egg is not fertilized. Your body is getting rid of that. So again, it's releasing the blood, the mucus, and all of that. And then during this time, usually symptoms are worse for most women, the PMS symptoms. So again, the cramping, headaches, that sort of thing, the mood changes, all of that. After that phase happens, you move on to what we call the follicular phase. So if you think of like all the reproductive organs, you have sorry, I don't have a picture, I should have printed it out, but you have like ovaries, your fallopian tubes, and then the uterus. So during the follicular phase, your body is creating these little sacs for the eggs to mature in. And sometimes women have a couple eggs that mature and drop, which is where you get twins. Sometimes we have one mature egg, which is the most common, and that drops into the uterus. So during this follicular phase, your body is getting ready to produce this the safe space for this egg to mature. So this starts on the first day of your period and ends when you ovulate. So this phase kind of overlaps with that menstrual phase. During this time, your hypothalamus and your pituitary gland, which are 2 hormonal glands in your brain, are doing most of the work. During this time, they're going to be stimulating the ovaries to produce the follicles, which are going to help with that mature egg. So a lot of different things are happening. So when, we see women who have trouble getting pregnant, it's there's so many different things that can be off. You know, it could be your thyroid that's off. It could be the pituitary gland, the hypothalamus. All of these are hormonal organs that are going to help with the production of different hormones that are going to help women develop a safe egg and drop that egg for it to be able to get fertilized. And then also in that process, your uterus has to produce a nice thick lining, a nutrient-dense lining for this egg to actually attach to, so that it has a safe place for the embryo to start the process of becoming a little baby. All right, awesome. So then also during this phase, these follicles will set off a lot of estrogen, and that estrogen is going to start to thicken that wall of the uterus. So again, that's going to be a nutrient-dense environment for the embryo to grow. And then next we have, let's see. Okay, this phase is like 16 days long, about, depending on how long your cycle is. You know, some women have 28-day cycles, some women have 31-day cycles. It just depends on how long your cycle is. And then you would move on to ovulation. So ovulation is the actual release of the egg from the fallopian tube into the uterus. And what's happening is the rising level of estrogen levels is what helps move that egg where it needs to go. So again, lots happening here, different hormones working, different glands working to produce those hormones. Our body's in full action and it's capable of so many cool things. The egg then travels down the fallopian tube into the uterus, like I said, and then usually there's a rise in temperature during this time. So a lot of ways women check to see if they are ovulating is by taking their temperature. So your body temperature will actually increase. We'll see some issues with that here in practice. Like if your body temperature is not increasing, there are some things we can do to promote that and get ovulation going in a good direction and make sure it's actually happening during your cycle. Also during this time, what's going to happen is the texture of your discharge may change. So it may be more of a thick, like egg white type texture. So you can notice a difference in this as well. And this ovulation happens about halfway through your cycle. So if you have a 28-day cycle, it's usually about day 14. And you have about a 24-hour period, a window where that egg is nice and fertile and it's ready for the sperm to attach and create the embryo, or for it to dissolve into the body and your period will come. All right, next we have the luteal phase. So the luteal phase is when you start producing different hormones based off if the egg was fertilized or not fertilized. So if you do get pregnant, your body is going to produce something called HCG, and this is what the pregnancy test is going to pick up on. If you take like an at-home test, it picks on that rise in that hormone level. This is what helps keep that uterine lining thick so that the embryo can grow and be a healthy baby. Next we have, if you're not pregnant, this will shrink away, this luteal lining will shrink away and dissolve into the body and be reabsorbed. And this leads to a decrease in estrogen and a decrease in progesterone, which also causes your period to start. So for those women who may feel like right before their period is when their symptoms are the worst, it's because of that drop in estrogen, that drop in progesterone, that you're feeling those symptoms happening. And then, so those are the different 4 cycles of a menstrual cycle. All throughout the month, our body is changing. It's doing different things to prepare us for pregnancy or to not be pregnant. So awesome things that the body does. So cool. Next, I'll talk about some good feminine care products to use during your cycle when you are bleeding, because those are just as important as anything else that you do. So, you know, number one, tampons are like, okay, they're convenient. You don't have to worry about a pad or anything like that. But what tampons do actually, especially if you're using like Tampax or like some generic brand, they're bleached, they have chlorine in them, they're not good for us, they're full of chemicals. The cotton can actually, little pieces of cotton can get stuck in inside of us even when we remove the whole thing, and it looks like everything's out, but that can happen as well. So you want to avoid using tampons as much as you can. If at all, don't use them, period. What you want to use are things like organic cotton pads. You know, period panties are a huge thing now. They've turned into this like major resolve for us who don't want to use, you know, tampons or something like that. And it's like in a pad that's already put into the panties, and you just wash them. And I've heard great things about them. People love them. So try those out. You could also use like a menstrual cup. Those can be some people's favorites and some people hate them. So you'll just kind of have to mess with what works for you and what works best for your body and your cycle. All right, awesome. And then let's see, doom. Okay, and I mean, like I mentioned at the beginning of the video, consider ditching your birth control. Talk to your primary, obviously, about that. And then if you have questions or concerns, if you're a patient here, please feel free to talk to your practitioner about those. And we can just give you our best advice. And if you're on a program, what we're doing more than likely is helping balancing out hormones. Hormone issues are such a major thing nowadays because we run into so many different toxins. Our bodies are just overrun, overworked, and things like women, especially our thyroids, are completely off. So talk to your practitioner here at Thrive, and we can lead you in the right direction with that as well. And then things you can do to increase, the good hormones and make sure your body is more at a normal state during your cycle. Magnesium. So magnesium is present in so many reactions in the body and especially involved in hormone reactions. So you want to make sure you're getting enough magnesium during that time of the month, whether it's oral, topical, however you decide to get it in. You could do both. So we have like topical magnesium oil that's really great for hormone balance. And we also have different I said topical, I think, sorry. We also have different oral supplements that you can take, like magnesium lactate, natural calm. There's something called Easy Mag that we carry. So magnesium needs to be present for our body to actually go through these phases successfully and ideally without pain or other symptoms. So then you can increase your magnesium, your minerals. Castor oil packs are a great way to help with pain, reduce pain. Those who suffer with PCOS and like endometriosis, so who go through a lot of pain with their cycles, that sort of thing, castor oil packs are amazing. Please try them out. You can Google the instructions. It's super easy. You don't need a lot to do it, and you can do it right at home. Let's see here, and you diet-wise, you can just up your veggies and your protein intake during this time, especially because what's happening is obviously, since we're also, if you're menstruating and you're bleeding, you're getting rid of a lot of things. I mean, there's iron in blood, so we're getting rid of a mineral in that way. Our bodies are working really hard, whether, we're not breaking a sweat or anything necessarily, but our bodies are working hard. And so you want to give your body the tools that it needs to be able to do that job correctly and with efficiency. So lots of minerals, lots of protein, lots of veggies, and that's going to all help, with this cycle. If you have good cycles, bad cycles, things go up and down. Sometimes our bodies are just leveling out. So if you have a couple bad cycles in a row, just keep an eye on what's not great about them, why it's off, that sort of thing. Also, a lot of liver congestion can come into play with our menstrual cycles because our hormones are, they're, I guess you could say, like, I'm blanking for the word right now, but they're filtered, thank you, through our liver. And so when you're going through your cycle, if your liver is congested and not doing what it needs to do either, then that can play a whole role in things too. The whole body is all connected, so make sure you're taking care of yourself. And if you have any questions specifically about menstrual cycles or how to help your period not be so horrible, please come in. We'd love to check it out for you and talk to you more about that. All right, everyone, I hope you have a great day.